Hi, everyone. Welcome to AC Reconnect with Health Services. I'm Rose, the Healthy Promotion and Education Coordinator with Health Services at Algonquin College. So today, we will be featuring cold and the flu topic, including the flu vaccination. And please note that today chat is recorded, so you can have an access to it later on at the Health Services website. I would also encourage you to submit any questions into the chat box, or you can ask any question by the end of the session, as we will leave the last 5 minutes for questions. I'm happy to have today with me nurse Joanne Stynes. Hi, Joanne.
Hi, everybody. I'm Joanne. I'm a registered nurse working at Algonquin College Health Services, and I've been here for 2 years. My background prior to primary care is cardiovascular nursing.
Thank you so much, Joanne. So at the beginning, would you please tell us a bit about Health Services Clinic at Algonquin College?
I sure can. So at Health Services, we have a wonderful team of physicians, nurses, mental health nurse, and our health promotion. The clinic is open from Monday to Friday, 8:30 a.m. to 4:45 p.m., and it is by appointment only. Due to the pandemic of COVID-19, there are no walk-ins that are currently being accepted due to safety protocols. All appointments must be pre-booked by telephone, and our number is 613-727-4723, extension 7222. We're following all safety measures at our clinic to comply with Ottawa Public Health and the college policies.
Sounds great. So would you please tell us about the services provided at the clinic, and are those services free for students?
Wonderful, yes. So we offer many, many services. The clinic provides medical care, prescriptions, blood tests. We do venipuncture here, and results are received through the clinic. We do blood work that has been ordered only by our physicians, so not ordered by external providers. We do pap testing, STI testing, immunizations for programs for clinical placement, as well we do immunization catch-up for people who require them for employment purposes by physician ordering only. We do TB testing provided free of charge. Hepatitis B vaccines are available at a reduced rate for Algonquin College students. We do birth control consultations, as well as we do cell birth control here by prescription. Health Services provides information and prescriptions, including the NuvaRing, Ortho Evra, and certain birth control pills at reduced prices. And we also do emergency contraception Plan B. We offer excellent mental health support. We have a mental health nurse and can offer by referral telemedicine psychiatry clinic. Patients do need the referral to the clinic through a physician from our clinic. We also offer smoking cessation support, so you'd need to talk with a doctor for more information about that. Most services are free with your student health card, and your identification, such as your health card, should be verified by phone before the appointment. It's important to know that we do see international students here at Health Services with your GuardMe insurance. Please visit our website for more info about insurance and fees.
Awesome, sounds great. I think, Joanne, this year it is more important to educate ourselves about cold and flu. So in the beginning, the first question that comes to our minds, if a student or employee think they have a cold or flu, should they come to health services?
That's a great question, and it's an important one right now, particularly at this time of the year. If you're experiencing any cold or flu symptoms, the first step is to call Health Services at 613-727-4723, extension 7222. Our clinic is closed to walk-ins at this time, so calling us is your first step. A health professional will discuss your case over the phone and determine what the next step should be it a virtual or phone visit with one of our physicians. We're trying to keep any potential COVID-19 cases out of our clinic at this time, so it is important to call. Thank you.
Sounds great. And I think there are similarities in cold and the flu symptoms, but there's also differences regarding the intensity of the symptoms and how common they are. Would you please tell us more about this issue?
Okay, so yeah, so in the influenza, the flu, fever is more severe in the flu. Headaches, body aches are also more severe in the flu. Cold may have milder symptoms of fever and body aches, but you would definitely notice a higher fever in influenza. The flu can spread easily and quickly. You may also pass it on to others before you know you're even sick. So stay home if you're sick, maintain very good hand washing, and do not come to campus. It's very tricky to understand the differences sometimes, but the best is to rest, push lots of fluids, and take care of yourself and isolate for the first few days so you can take care of yourself.
So yeah, I do agree. And I think there are measures that help to prevent the spread of germs. What are like the main ones?
The main ones absolutely would be to wash your hands well with soap and water. And if soap and water is not available, to use hand sanitizer. Cover your cough and sneeze with your arm, not your hand. And if you use tissues, make sure you throw those out immediately. Stay home if you are sick. Absolutely stay home if you're sick. And it's highly recommended to get the flu shot every year. Flu season is October to April, and currently flu vaccines are available here at Health Services for students who are authorized to be on campus, and Ottawa Public Health is having many, many clinics.
Sounds great. And if soap and water is not available, you have mentioned that it's recommended to use alcohol-based hand sanitizer. Does the sanitizer alcohol percentage matter?
Yes, actually it does. Based on recommendations, it's preferred to use an alcohol-based hand sanitizer that it contains 60% or above alcohol to kill germs. Yeah, absolutely.
Awesome. So one of the cold and the flu symptoms is having a sore throat. I think many of us feel it, but actually we don't know if there is a natural way to relieve the throat. Is there a natural way to do so?
Yeah, a really nice at-home remedy that you can use to provide some relief to a sore throat is a saltwater gargle. The steps are quite simple, and most people do have table salt in their homes. So you would add a teaspoon of salt into a cup of warm water and stir it until the salt dissolves. You would take the mixture into your mouth and gargle for 30 to 45 seconds and spit and tilt your head back so it's actually, accessing the back of your throat as opposed to the front of your mouth. And don't swallow it. Make sure you spit it out. But you could do that 4 times a day. And you can try that for 2 to 3 days. And it is very, very beneficial.
Awesome. Thank you. So flu and cold may have similar symptoms to COVID-19. Is there a way to differentiate between them?
So it's really hard, and there are some ways to differentiate. However, it's tricky for a lot of people right now. I can't emphasize enough that for any student or employee who feels cold or flu symptoms, you should not come to campus. Ottawa Public Health has an excellent assessment tool to help us determine when to test for COVID-19 and what the symptoms are to be considered. The tool can be found on the Ottawa Public Health website, and it's constantly updated with the newest information out there. We do not have COVID testing here at Algonquin Health Services. Ottawa Public Health operates the COVID care clinics, testing centers, and assessment centers, and it is by appointment only. So that would be important to go to their website in order to book the appointment. With the cold, flu, and COVID, it's important to know because with influenza and COVID, you may have body aches, sore throat, fever, cough, shortness of breath, fatigue, and headache being shared symptoms between the two. But the biggest, one of the biggest differences is that people with the flu typically feel the sickest during the first week of your illness. And with COVID, you tend to have a longer period of illness and you lose your sense of taste and smell with COVID-19. So if that is a symptom that you are experiencing, you're more likely definitely needing to be tested for COVID-19. And important to know that if you are experiencing any symptoms, get tested for COVID-19. The only way to know exactly what's going on is to be tested.
I do agree. So you mentioned that we are providing the flu shots at our clinic this year. And I think the flu shots are really great way to protect not only ourselves, but also to protect those around us. So please tell us more about the details.
Okay, so this year we are offering flu clinics. They began on Monday, November the 2nd, and we have 9 flu clinics currently being offered. To book an appointment, you would call health services. And as long as you're an authorized student on campus or employee on campus, we are able to provide this to you. There is no fee for the flu shot this year. And as Rose said, it's very important to protect yourself and others in your community. We may get more supply, but as of now, we have 9 clinic days only, so there's no guarantee that we will get more. It's quite possible we have a much higher demand than we do vaccine this year. So we emphasize getting that flu shot as soon as you can. In keeping with the college direction, we do need to minimize traffic on campus, okay? So as I said, we're only seeing students who are approved to study and work on campus, as well as those students living in residence. And for everyone else, there's information on the Ottawa Public Health website on how to get a flu shot by appointment as well. And pharmacies are receiving supplies, but it's coming and going at pharmacies. So I would recommend Algonquin College or Ottawa Public Health to obtain your vaccines.
Sounds great. So just to confirm, so the flu shot clinic is open for students and employees who are either working or living in residence, or who are supposed to be in the campus. So we're not accepting anyone just to come in to get the flu shot and to leave the campus, because this is against the college policies, right?
Yes, absolutely. You do have to be approved to be on campus this year. And it also is due to the fact that our supply is not as abundant as in previous years.
Sounds great. And for international students who do not live in residence, nor have to be on campus, can they receive flu shot in the community?
Absolutely. So Ottawa Public Health is offering flu vaccination through their community clinics at no extra charge. And so you would go to the Ottawa Public Health website and look up under immunization information for the influenza vaccine. Yeah, there is no upfront costs to international students.
Good to know, actually. And I think there will be also so much information on the health services website and on the healthy promotion page. We have actually created a separate page under the healthy promotion for education about cold and the flu. So I would encourage you all to visit the page and refer to it whenever you have a question. You can actually see many of the information that we had today there as well, and added information about antibiotic resistance, hand hygiene. I find the topic of the hand hygiene is very good one as well, because we all know about proper hand hygiene. However, I find we have more and more details when it comes to proper hygiene. Like when I did my research, I knew that we should be taking care of our skin. So it shouldn't be like peeling or chafing because it allows more germs to enter our skin. So I didn't know that before. So the good first step for me is to taking care of my skin and my hands and apply, as Joanne mentioned, hand sanitizer if possible. If there's a dirt, then washing by soap and water is recommended. But hand hygiene is also should be alcohol-based of 60% and more. So I think like those information, we feel that those are basic ones. However, there are many details that come into it, and tying all of those information together, I feel we're having more clear idea how to educate ourselves and how to prevent ourselves from getting cold or flu in the first place. And then if we got the cold and the flu, we are knowledgeable how to manage our disease, where to go, and those kind of questions. So I think this is great. The session has been so great with you, Joanne. If you want to add anything else to the end.
Well, thank you for having me. I think the emphasis this year is really on knowledge is power. So utilize the resources that are out there to try to understand if you are feeling unwell, what might be going on. Please get tested if you're symptomatic at all, because there is such a blurred line between COVID-19 and influenza. Get the flu shot and wash those hands.
Sounds great. Thank you so much, Joanne. As I mentioned, you can visit the Health Services website and visit the Healthy Promotion page for more details about cold and the flu. Thank you so much, everyone. And thank you so much, Joanne, for informing us about this important topic, especially for this year.
My pleasure. I wish you all good health.
Thanks. Have a great day.
Bye-bye. Take care.